capillary puncture. So capillary puncture on finger poking. The first question we will ask our patient after introduce ourselves, after we confirm the patient's identity, we're going to go ahead and ask them when was the first time they ate or drank something. Anytime you check for the glucose or hematocrit, it is very important that you guys understand when was the last time they ate. The only way you know which questions to ask is your provider order. Now with nothing by mouth and fasting is two different things. So if Zoe was told to come in to get tested for certain lab, she was probably told that nothing by mouth. That means she was not allowed to drink or eat anything at all. But if they were told, no, nothing by mouth, nothing. But if she was told, come fasting, that's a different thing. Fasting, they can drink water, they can drink certain coffee, but there cannot be any sugar or cream on it. And the provider will tell them that. So do not get confused between nothing by mouth or fasting, okay? So if Zoe's tests were supposed to be nothing by mouth and she said, I just drink some water or coffee, I'm gonna stop what I do. I'm not going to poke her before I check with my provider. Because I'm going to torture her, put her through everything, and then the provider is like, we can't run this test, right? So I will confirm my order from my provider. I will check with my patient, and everything is good. Then I go ahead and get started from there. I will ask any questions I ask you, say you never had it, so I can explain it to you, okay? So Zoe knows that she's gonna get a finger poke and hematocrit. Have you ever had a finger poke before? Okay. So what we're going to do is we're gonna clean your finger with alcohol wipe. Or do you have any allergies? Perfect. Are you taking any medication? Okay. So say blood thinner. Other medication, I'm not worried about it. So if your patient says they are taking any sort of blood thinner, you stop and you get your provider. Because if you're not able to stop that bleeding, that patient can die. Okay? So are you taking any medication?
Or blood thinner?
You're taking blood thinner.
Yeah.
Okay, so I'm just gonna go check with my provider and I'll be right back. Okay? I went to check with my provider. They said, okay, go ahead and have them lie down. I'll be right there. Because they need to be monitored in case the bleeding does not stop. All right, so everything is good from here. I'm gonna go ahead and poke your non-dominant finger, non-dominant hand. We try to avoid the point finger. So it's middle finger and ring finger are the appropriate one. So don't ever poke the thumb or pinky, okay? And then I'm going to collect a quick blood draw on your glucose. The provider wants me to do a hematocrit as well. And then these are my tubes, and I'm gonna collect 2 tubes from your finger in here.
What is hematocrit, you said?
Hematocrit is the percentage of the red blood cell. As I said, we will talk a lot more about those on our lecture class. Right now, I'm only showing you how to do it. Hematocrit is always the percentage. That's why I'm collecting 2 tubes of blood draw, and then we will centrifuge those, we will count this, which I will show you, and we'll do this percentage of that, okay? Yes. Can the questions wait till the end? Just write it down so you don't forget, okay? Write it down. All right, Miss Dewey, which hand would you like me to go? Okay, go ahead and roll your sleeve up for me. So what I'm gonna do is I'm gonna go ahead and hold my patient hand. If Zoe's hands were cold, I have 2 options. I can have her to run her hands under the warm water, or I will give her a heat pack, okay? So I'm just gonna go ahead and look at that around to make sure there's no rashes, any red marks, any bruising and anything. Then I'm gonna go ahead and go on the side. This is going to be flipping me off, but we understand that this is totally okay. This is for the purposes of lab. What we want to do, guys, we want to make sure that we do not go on the flashy area. So everybody look at the tip of your fingers. You never want to poke someone right on that flashy area. And you don't want to go too close to the nails, correct. Every time that I used to poke my patients prior to cleaning him or wiping it out, I look at it first. I'm like, okay, I know where I'm gonna go. So I have a area landmark that I want to go. I'm gonna go ahead and grab my alcohol wipe, put it right on my patient. Start from circle, start from the middle, and work your way out. You are never to fan that area, blow that area. I'm gonna let it dry by itself. While that's drying, I'm just gonna go ahead and get my lancet ready. With these guys, you just hold it and twist them. When you twist it, that automatically comes out. These are to go to sharp because it has a needle in it. When you're poking your patient finger, you just push this down and the needle comes and poke your patient. The first draw of the blood has to get cleaned. It's contaminated, so you will not have an accurate result prior to testing poking my patient, because it can easily stop bleeding. So I'm gonna have all my materials ready. This is the glucose machine that I have. This one is to have the blood drawn on it. The opposite side goes in here. I don't push it down, I just set it. Like, see it easily, I just set it on it. This is ready to go. Now that area is dry, so I'm just gonna hold my patient finger. Zoe, would you like me to let you know when I'm poking, or just go? Just go. Okay, so I'm just gonna hold this down. I want you to take a deep breath in, and that's it. Okay, so the bleeding stopped. The first drops gets wiped, and now I'm just gonna make sure that my patient is not bleeding a lot, or the bleeding stopped. As soon as I push that down, the machine is gonna walk me through it. It says to draw the blood. Okay, so I'm just gonna hold that right here, and that starts counting, and it's gonna read it. While that's going, I'm just gonna go ahead and collect my 2 tubes for my hematocrit. These tubes have a red area and the clear one. When you go ahead and turn your hand a little bit towards me. When you are collecting the blood, always the red area goes against the patient. It has a vacuum thinner in it, so it just like, as soon as you just hold it against the finger, it just sucks the blood in. Once you hit that radio, we're gonna put a little bit of clay. I'm gonna put this down here because I'm not done. So the red is again away from my patient. The clear side is towards my patient. And right now I'm not squeezing her hand. The blood flow is pretty good. I hit my red, so I'm just gonna go ahead and put a little clay. And now I'm gonna take care of my patient finger. I'm done. So I'm just gonna hold that for a second, making sure that the bleeding stops. Then I'm gonna go ahead and put a little Band-Aid on it. Patients who are diabetic and get their fingers poked a lot, the tip of their fingers can be very sensitive. So you just always want to make sure that you're being careful and find an area that you can avoid. All right. Now we're just gonna go ahead and write this down on our documentation. You guys will learn what is the normal value of glucose for our female patient. You guys will have to memorize the female and male, which we will learn about it on our lecture class. Whatever I get, it is not within the scope of my practice to tell my patient if it's normal, abnormal, or so on. If they want to see, they can see it, but if they ask me any questions, I'm like, I will let the provider know.
What is the normal range?
Isn't it 120?
It's 120, 100 to 120, but these are not accurate. These are not calibrated. So these things are not real, guys. Do not diagnose yourself. This is just for practice purposes, okay? As you guys saw that I took the sharp, put this in the sharp because there's blood on it, so I don't want to put it in our garbage. Now that I'm done with this one, I'm going to go ahead and document it. With the machines, if you, in the real life, you do have to scan the patient's barcode, and then you have the badges, you scan your badge. So the result automatically goes through your patient chart. But for the sake of it in here, that we're just gonna say that it didn't work, so we can go ahead and document that. For this one, we have to centrifuge these. It takes 3 minutes, so I'm gonna put that into centrifuge. Then we'll come back and read it together. The reason we collect these 2 of these, they come in different sizes. This one tells us a lot of this. In this hematocrit, we can see the red blood cells, we can see white blood cells, and also the buffy coat in there that has the white blood cells, and then we see the serum, plasma, very, very clearly. Once we centrifuge these, then we will go ahead and put these on our measurements that we have here, and we will read these. Whatever number we get off of our red blood cells, we count this. For example, if we get 20 on this one and 20 on this one, we add both of those together, which is 40, and then we divide them by 2, which is 20. Okay? We will show this out. I'll show you guys this after I centrifuge this. But before I go and get started, any questions?
Sticking it in that
Oh,
thing
boy.
and calling it
Say one more time.
Sticking it in that thing called centrifuge.
No, this is